Good evening, everyone. This is Dr. Ellithorpe. This is Tustin Longevity Center here in Tustin, California, Southern California. And we are doing the Ask the Doctor Anything. We do this 6 o'clock to 7 o'clock every Tuesday night. We do this as a information education blessing to our family, friends, patients, and relatives. There are many, many questions about the interface between physicians who are what we call standard of care allopathic medical doctors and those who practice alternative, functional, integrative, complementary medicine. It's had various names. I just call it good medicine. And so this is not meant to be specific medical advice for anyone. When you ask me these questions or give a set of symptoms or describe whether it's yourself or a family member having these symptoms, my advice is not meant to be personal advice for management because you're not here. I can't see you. I don't know exactly what's going on. So I'll talk in generalities. Of course, if anything is prolonged or not doing better, you should see your own medical doctor or urgent care. Today we have, again, our email questions. I have a couple of pages. The way to send an email question in is to get onto our newsletter. That is at tlcdoctors.com, tlcdoctors.com. And then you'll see a link there for Ask the Doctor Anything question. Type in your question to the link there, and that'll come up to me every Tuesday. I get this shortly before we go live, so I don't have much time, if any at all, with my busy day of work to look at the questions in advance. Sometimes I know the answers, sometimes I don't, but I can, in general, either follow up the next day. So very often will help me with my education or look into things that my patients are trying to learn about. So I stay up to date with them. We have been practicing functional alternative medicine as standard doctors. We're trained with our normal allopathic training, medical degrees. We have a gynecologist who is on our staff. I'm in general practice. We have a physician assistant who has been practicing a long time, largely specializing in urogenital issues, and then another family practice physician assistant. So right now, the four of us can try and be a help to you. So if you're interested, you can call our office 714-544-1521 to try and see if you can get in and be seen. Normally, I am full and not taking new patients unless it's under extreme pre-decision and permission, because I've been practicing 44 years, so I have a very full slate. I am in my 70s, so I do have to try and take care of myself. I do work full 5 days a week, and you could say 6 with all the extra studying that I have to do. So we need to be good to me too, so I can stay functional and helpful to the need of the people. Okay, and then we have the live people here who chat on the internet through YouTube in the chat room. These are live questions, people who are with us watching right now. And so I will tend to answer their questions first, then I'll go to the email questions. So we already have live questions coming in. And the first one is from Jennifer. And she says, "Hi, Dr. E. A relative 70-year-old is going off her hormones. She was told you shouldn't be on hormones for too long. Is that true?" Well, the question all of you need to ask those doctors who make those statements, I'm presuming it is a physician that told her she should not be on them that long. Ask for the scientific data or reference paperwork, clinical data that they're making their decision on, or is this just hearsay? And indeed, a lot of medicine is not supported with clinical scientific data, and more so in the world of natural hormone replacement, natural diet, and immune support, supplementation, vitamin C. They're just all this money has been wrongfully sucked up by private interests, big pharma, big medicine, and the lobbyists have taken their middleman high dollar payment. And so we have trained up a bunch of doctors who are not educated enough on human natural ability to heal. So, my answer to that is I have 44 years of active medical practice. In that 44 years, I started in emergency medicine, general family medicine, and all the way from delivering babies to treating the high performance pilots as a flight surgeon. My dad raised me up in food research. He worked for food research. So I've always been studying the biochemistry, chemistry, and the natural sciences. I've been in the mom and pop vitamin shops since I was a tiny child, 65, 66 years ago, because I can recall being there when I was 4, 5, 6, 7 years old. So my appreciation for the natural is very widespread, and I have a lot of experience. All the women who have been on natural hormone therapy, to my experience, have lived healthier, robust lives. In fact, just a few months ago, one of my patients invited me to her 100th birthday party, and she is on her natural hormones. And I started her in the 1990s. So my answer is no, you do not have to stop hormone replacement therapy. No, I disagree with any advice down that road. Rather, if you're a good doctor that takes care of the whole patient, you're going to be doing all those things that help support healthy hormone replacement practices, and such practices as drink enough water every day like a younger woman would have. Number two, take systemic enzymes that you take on an empty stomach. So when the enzymes go inside you, then they are absorbed into your body to disinflame your whole body. That will put to bed all the concerns about any risk for blood clotting, and that mostly was generated in the 1960s and 70s, early 80s, when they were using the very terrible horse estrogens like uh, the equine estrogens in Provera with that's the progestin, but the Premarin tablets. Also, exercise. We tell the women to exercise, and then we tell the women to get a good night's sleep, and then we tell the women to eat a low carb diet. And when you put all these things together with natural hormone therapy, then you don't have any concerns. You rather instead have a very healthy, slowly aging female. Hopefully that helps you, Jennifer. Uh, I intend to use my hormones well past my 100th birthday. And I tease by saying I want some put in my coffin. All right. Then the next live question is from Pilar. Pilar says, why is it okay to stay in ketosis forever? I heard it's not good for an extended period of time. Thank you so much for what you do and your contribution. Well, God bless you for that. Thank you for that nice statement, Pilar. Ketosis, nutritional ketosis, is not at all like what you hear about diabetic ketoacidosis. That is a totally different type of acidity, exposure, and risk, and is a medical emergency of itself. We're not talking about that. We are talking about people who are not uh, at risk for ketoacidosis, being usually insulin dependent diabetics. Rather, we're talking about people who are on a very low carbohydrate diet. And you can study populations if you want to do epidemiological studies. The Inuit Eskimos live their entire life basically on whale blubber and fish. So we know it's totally safe and it's totally compatible with a healthy, strong lifestyle and long-term living. The question is um, that it's uh, long term being a problem. And so hopefully that will give you comfort. And we're not talking about the severe ketoacidosis I had mentioned, which is a totally different animal. Um, Staying where your body has blood sugars roughly fasting after not eating 12 hours, when your blood sugar would be 85 to say 50 to 85. That's a very healthy range. When your triglycerides are usually between 50 and 75, when your insulin is fasting and you're usually 3 to 5, and your hemoglobin A1C is 5.2 or lower. So these are normal physiologic parameters for a healthy long life, reducing the risk of cancer, reducing the risk of cardiovascular disease through the high blood sugars scratching or injuring the endothelial lining of every blood vessel. These are the healthy parameters to help you avoid joint damage and inflammation. These are the healthy blood sugars and parameters that help you avoid Alzheimer's and dementia type disease, plus many other problems. So, yes, Pilar, it is safe to have a low carbohydrate keto lifestyle where your blood sugars are in these safe, healthy parameters, and you can do this lifelong. Okay, so now we'll take some of the questions that are sent to me. It says, from Johnny S., have you seen evidence for glucose benefits from apple cider vinegar? That has been well known for many decades. Anytime you use apple cider vinegar, especially if you are a blood type A person without enough stomach acid and enzymes to digest your food, and you add in apple cider vinegar, which is uh, acetoacetate. This is a typical fermentation product acid, and therefore quite natural. And if you use this with your meal, before the meal, after the meal, every time you eat, you're going to get better nutritional satisfaction or derive more nutrients from it. It'll satiate you, and you tend not to eat as much. As to the biochemistry of it, really absolutely mitigating the glucose uptake on the cell membrane surface and its processes through the intracellular and intramitochondrial tricyclic pathway, Krebs cycle pathway. There are nothing to my recall that I can just produce right off the top of my tongue or head. But indeed, it has to do with better digestion and breakdown of the food that you're eating that is more satiating, to the best of my knowledge. Cher asks, what is the protocol for severe Candida glabrata? My husband has been to every infectious disease doctor in Orange County and cannot get rid of the infection. It's been over a year now. He has type 2 diabetes as well. Too much sugar in his diet, I know. Well, that's extremely problematic because sugar depresses the immune system. Sugar is a damage to the vascular walls, the lining of your blood vessels, especially the tiny microvasculature area. And so sugar is a known immune suppressant that allows all the diseases, especially the fungal candida growths, to multiply and predominate. It is promoted, fungus, especially in a low oxygen environment, which when you scratch the tiny capillaries with all the sugar and you create damage to the microvasculature. You get retinal disease, you get Alzheimer's, foggy thinking, you get peripheral neuropathies, and then you get the vascular diseases, and then the amputations from poor circulation. And this is all a process of high blood sugar. He has to face the fact that he has to exercise with weight resistance bearing, so he builds up his muscle, and to be on a very low carbohydrate diet if he can see a good functional doctor and under the care of a physician, to be guided through with his diabetes on checking his insulin, his fasting blood sugar, his triglyceride level, his hemoglobin A1C, and working that through, checking it maybe every month or 6 weeks to see him bringing those parameters down, and then getting a high dose vitamin C drip to immediately boost up his immune system. Then maybe collateral therapies from our standard training, such as nystatin is an antifungal, and maybe fluconazole could be tried. Then you would try these in the face of someone who is trying to lower their blood sugar and doing it, and exercising, not eating late at night, getting high dose vitamin C, getting their vitamin D level up, getting their zinc level up with a good functional medicine doctor, and then the infectious disease doctor or the other physician who specializes in this can then apply the other standard of care therapies, and they'll be much, much more effective. But you can't go back to eating a high carb diet. If he's a diabetic already, this is not something fix it and then go back to that lifestyle. It is saying goodbye to that bad pattern, whether it's not enough exercise or combined with a high carb diet. Even if he's insulin dependent, we can tremendously turn this all around when your functional medicine doctor works with your standard doctor. The treatments will work much better. I would also make the argument he probably should use chelation, EDTA, ethylene diamine tetracetic acid, IVs every week until he does 40 or 60 of them, because this is well known to improve microcirculation and improve the immune system by improving perfusion of the tissues. So that would also be given with the high dose vitamin C. And I've seen that turn people around over and over and over the decades and decades of my experience. Hopefully that helps you. Next question. Amela says, "Hi, Dr. E. I recently listened to a doctor from Europe who says that it is not good to drink water before the meal, while eating, or right after you eat, because you can get Klebsiella, which already lives in our intestines. Is that really true?" I would say not at all. I disagree. I always drink water while I eat. Now, your stomach needs to make enough acid, and that acid has to be there to help you digest your proteins and your fats, make enough enzymes to do it, to get the value out of the meal. If you drink a lot of water right before or with eating, you're going to reduce the enzyme concentration, the acid concentration. Now, has this been studied? I don't think there's been any rigorous or well-published studies on this. Your body will make more stomach acid. The argument comes if you drink basic water, alkaline water, will that pH of 9 in your water offset the digestion for your stomach? Same argument. And the answer is, it turned out really not. The acid that you produce is usually generally good enough. However, they did not control, I don't recall the study at this point in time, but I know there was no control for blood type, because hardly anyone does that. A-type blood people make the least in general amount of stomach acid and stomach enzymes for eating. So they would more clearly show any potential for poor digestion lower the ability to kill off pathogens that may be in the food. Because if you don't have enough stomach acid, it also is involved in killing off pathogens. So there can be some intestinal overgrowth. Therefore, we need enough money to be sent for research. For these are the questions that I've had for many decades, and there's never money for food research because nobody can make millions and billions of dollars. And there won't be a middleman or an insurance middleman or a pharmaceutical middleman who is going to suck off all the profits and falsely, what I call through mafia type action, pump up the prices. And the poor patient is not getting good advice on healthcare. They're just sucked into a focused organization that uses human suffering and disease and misery and injury to design a profit industry over that they can really market as their care, when in fact they're really the bad guy offering an ice cream cone to the kid on the street and then kidnapping him. So I think that's what medicine has become today. That's a lot to be said about water in the meal. Basically, I'm going to say no way is that an issue, at least in my 44 years of practice. Next question. Mano says, liposomal bamboo silica. What is it best used for? Some say as a binder. Well, liposomal is fats that are encased like a cell, the double membrane, and it goes all the way around, and you create these spheres. That's what they were doing with the unfortunate mRNA technology that has come under such scrutiny lately for its many unreported risks. The fat glob will then have inside it silica. Silica is everywhere. It's in crystals. It's in quartz. Silica is basically a mineral. It's an anion. And it usually is combined with oxygen and is called silicon dioxide. This can be linked with many other things, silicone, what else other than oxygen? I can't think of that right off the bat, but it's everywhere. It's in human beings. It's in the structure of the shell of like plankton. Plankton uses silica minerals to create the little ecoskeleton on this. And so it's everywhere. And it's in structurally in a human body, animals also. So the question was, what is it best used for? I think they can market anything. I remember as a little girl, I was 4.5 years old, sitting in my father's food research labs at Armour. And I was quiet, and I was behaved. And we were in the taste testing room. And in the taste testing room, I would hear the men, the researchers, talk about and laughing how they could make their customers eat. And I can't say the word on YouTube, but it's a foul word. But you can imagine it if I say excrement. They could make us eat excrement if they put enough butter flavors and salt flavors and sugar flavors in it. And sadly, since I was in my 4-year-old, so that would brought us to the early 50s, I have seen the damage that they have done in the food industry. And they have really harmed everyone. So silica could be manufactured into anything. I don't think you have to work to try and get it into your body. It's in plants, it's in plankton and other living forms, and it's in us also. So I don't think you need to supplement with it. Instead, I think somebody's taking advantage of this idea and trying to market it and make money on you, when it would be far more beneficial for them to get a medical degree, a nursing degree, and work in a service ministry to teach people how to eat well, exercise, get a good night's sleep, treat their bodies, their temples, uh, in a healthy manner, to drink enough water, to get enough sunlight, and so forth, rather than to try and put their brains together on trying to market one more thing and say it'll help this or that, when we know it's in everything. So you can market it. It helps everything, and just emphasize your brand. I am tired of it. I am tired of marketing. I want to see people who help people rather than try and use them to make a sale. Let's see. We have another live question here. Let's see. It says, Christina, hi, Dr. Rita. My husband is 43, overall healthy, but started getting night sweats about a month ago. What should he be checked for? There are many thoughts on that. If he's prior military and he was exposed to malaria, he could have been bit by a mosquito. So that can produce sweats, cyclical episodes of chills and sweats. There are other hormone, adrenal, hypothalamic parameters, endocrine disorders that can cause this. The worst concept would be a multiple endocrine tumor. So I would share this with your medical doctor, get his hormones tested, and stress hormones, blood sugars, maybe even consider if he's snoring, if he's getting sleep apnea and stressing for that, how his cardiovascular system is doing. So there are many things that I would address, but that's not typical. So I would have you see your doctor and start working that up. Pilar also said, a doctor at a fasting clinic told me that stevia is like putting oil on a fire in my body. What are your thoughts on stevia? I think it's a argument. It is, at least it's not aspartame or aspartame, however you want to pronounce it. That's probably the most well-known and earliest sweetener that has 0 calories. That's in all your standard 0-calorie Coca-Cola, 0-calorie Pepsi products, and their offshoots like 7-Up and Mountain Dew and ginger ale, things like that use aspartame. Then we get into that group that has the stevia. These kind of sweeteners are a mixed bag. I'm not going to say they're not unsafe, but I'm not going to say they are a high risk for anything that I'm aware of at this time. Monk fruit, xylitol is probably, of all the sweeteners, xylitol is a sugar that has a sweet flavor and is very beneficial on many, many levels. So if I have a sweetener in my house, it's going to be xylitol. My second choice is monk fruit. These sugar alcohols like erythritol and stevia, I just see too many GI issues, digestion, long-term issues, and your microbiome as a problem. So that's how I feel about that. Christina says, is cancer genetic or is it about the individual? It's really about the individual. The idea that cancers are genetic have, I think, been so extremely rare to pin the tail on the donkey. Remember, they wanted to solve everything through a individualized genetic drug they would make for you for any disease, any situation. So when the DNA was discovered, and then the sequencing was all finished by 2000. There was just this explosion and wishing that everything would be solved by DNA identification, DNA repair modification, or designer medicines based on your DNA unique problems. But here is one of the big problems with cancer, and they don't want you to hear this. So you should ask your doctor and you should ask your oncologist. The issue is when a tumor is growing and they take a biopsy of it and then they chop it into pieces and study it, you're not going to find the same genome in every cell. In other words, it isn't a genetic, perfectly that replicating material. It's discordant. The DNA sequencing in one group of cells will be different from the other. And this goes for all cancerous, rapidly, abnormally growing cell division in any living system. So how can you blame it on a gene? You have to ask what happened that the person was without cancer years before and now they are diagnosed with it. And then the argument is the cancer that people are finding today, for the most part, except there is a new caveat now with this unfortunate mRNA injections that was foisted on, and no one would listen to us warning when it came out. This mRNA has a turbo cancer division that is linked with it. I've been listening to more and more oncologists worldwide talking about something is being triggered through probably immunosuppression and function of the immune system in the recipients of this, and the T cell function for killer cell, natural killer cell surveillance that goes on all the time in our body, looking for cells that are misbehaving. And the argument is we have cancer tumor cell progenitors, stem cells, circulating tumor cells all the time in our life, but it is identified by a healthy immune system through our T cell killer cells primarily, specialized mast cell activated lymphocytes. So they're predicting that cancers today are really slowly growing over maybe 8 years by the time it becomes big enough to be imaged on a mRNA or a MRI machine or a CAT scan, which, we can pick up something around 4 or 5 millimeters that is a tumor. So we have to say, and I'm going to say that what I've been involved with for let's see, the first time I gave a lecture on the topic of thoughts on cancer treatment, thoughts on natural alternatives, was in 1974 when I was in college. I had an organization I created called Students for Responsible Expression. And us nerdy type people there in the biochemistry, we had read the book together called, by Edward Griffin, Cancer. What is it? Edward G. Griffin, who wrote the book Jekyll Island, The Creature on Jekyll Island. And the name of the book on cancer was The Cure for Cancer, but it was about amygdalin, vitamin B17, and how Dr. What was his name? Pritikin? No, that was the other doctor, Dr. Privatera, who is now passed, wonderful man. He would give vitamin B17 injections to cancer patients and had very good results. His clinic was raided. He was shut down. He was put in jail for years for this. Why? All because of vitamin B17 injections. No one died. Vitamin B17 has cyanide in it. We have an enzyme in our body, like when we eat an apple, and we can get B17 from the apple seed. That's why it tastes so bitter if you accidentally bite on an apple seed or the pit of a apricot. Apricot seed are the richest source for amygdalin, vitamin B17. World Without Cancer. Yeah, that's the name of the book. World Without Cancer. So I was giving my first lectures on natural approaches to manage metabolically, dietarily, lifestyle uh, cancer. And what it did is the uh, cancer cells would not have the enzyme rhodinase that would denature the cyanide that is inside of vitamin B17. Now we have cyanocobalamin. Most of you people get B12 injections from the cheapest cyanocobalamin, which is cyanide in the uh, B12 injections. And yet they went after Dr. Privatera, jailed him, really hurt this man and his family. I visited him, and long and short of it is I go along with Otto Warburg's Nobel Prize winning research for the Warburg effect, which means metabolism in the engine mitochondria, energy metabolism is injured, hurt by a bad lifestyle. Very often, high sugar, diabetics, and overweight, obese people have a higher incidence of cancer in general. And so, this high sugar, insulin, chronic mitochondrial metabolic damage and strain generates male energy production, poor production, which means the cell is starved for energy and it sucks up sugar to go into a facultative anaerobic metabolism. And I've been teaching this and talking about this for many decades. Finally, Dr. Thomas Seyfried has money and research and time to spend on focused issues like this, praise the Lord. And he wrote the book, Cancer is a Mitochondrial Metabolic Disease. That came out many years ago, I think 2012. But we had been teaching this back in the 90s. I had been working with Dr. Brzezinski in Houston, Texas, when he was using a metabolic therapy called anti-neoplastins, which is a type of amino acid therapy that he would get from urine. And we had some great breakthroughs in the metabolism and reversals of primarily brain tumors with this. So I don't think it's genetic at all. I think it is a metabolic energy production utilization of glucose and glutamine. I had been asked on the channel here before, do I think glutamine is dangerous to cancer patients? And in the scope of things, taking additional glutamine, like glutamine powders in for stomach upsets, is not the thing to do. I agree with that. But in general, to eat fish or turkey or beef, I don't think you're going to get enough glutamine on a carnivore type diet, which is very metabolically low glucose generating, that it helps to kill off starving cells, along with other therapies like high dose vitamin C, other metabolites like quercetin and berberine and turmeric, and many others that can help block glutamine uptake and metabolism. So this research is far more productive. I have seen many more amazing turnaround, certainly in my brain tumor patients that don't die from their glioblastoma multiforme many years after being diagnosed. So it is metabolic, and genetic is a tiny fraction. There is a division of research, again, those in alternative functional medicine. When I did my second doctorate in 1999 and 2000, at Capital University of Integrative Medicine in Washington, D.C. for 2 years. I went there and we heard from the greats all over the earth, from Eastern medicine to a lot from Germany. Uh, and in that area, we were learning about developing immunotherapies to treat cancer. And there was the Collies vaccine, where I think it was staphylococcal byproducts of the infection were found to create a high fever, which then generated a metabolic and cytokine and certain immunofragments that were associated with tumor reductions. So these tailored vaccines, they hounded that doctor out. He had to go to the Bahamas or Virgin Islands to continue his research. The enzyme research by Dr. Gonzalez, he was hounded out. See, if Big Pharma Club cannot control money to be made from helping dear human beings suffering, then they create ad hominems and they create name calling, and they use the power of the bully pulpit to make statements unfounded to uh, make people look away from these wonderful alternative therapies, many of which were immune therapies. And now we're getting things like Keytruda, which is a amino immunoglobulin management to help target the cancer cells. But I had been involved in research and studying this since the 80s, or certainly by the 90s. I am glad to see this happening now, but we have to get big pharma, big government, centralized government, lobbyists, and the middleman who sucks off the teat of the misery of the healthcare dollar and just plays bureaucrat on who will get treatment and not. Um, it is a crime, and we have to stop this. Get government out of healthcare, get government out of everything. Let it just be for the defense of our nation and our borders. And they've been doing a lousy job at that too until recently. So praise God, let the private individual stand or fall on their own merit. If there is a doctor harming people with therapies that are dangerous, the local people and families will bring them to attention of the local jurisdiction and sheriff and the lawyers that can prosecute or defend, and we'll determine whether this is true or not. And that is what malpractice is all about, bringing and sorting through what doctors stand or fall and are willing to uh, continue to work. They've frightened all the doctors into working for the big man, big Providence or Hoag or St. Jude's or St. Joe's, big extended groupies. So they have to obey the man. They have to obey the man. They can't do unique things. So nobody's doing private medicine anymore. It used to be the vast majority. Now it's a very rare thing to see a doctor live independently. And it is hard and it is expensive. But I tell you, I'm the healthiest and wealthiest doctor in healthy patients. I am. And I'd rather have a middle class financial record or less and have the healthiest and the longest lived patients on the earth. That's what I want. So where was I at with that? Long down the rabbit trail? I was talking about the genetic. Is it genetic? So very extreme rare conditions would be linked with that. All right. Dolores says, "Hi, Dr. Rita. I was told I need to wear a mouth guard at night since I was rear-ended and had lockjaw." Okay. What is your take on this? Thank you and God bless. Dolores, I'm not a specialist in the orthodontists and the dental scenario and C-spine stabilization and all. It sounds to me like you had some trauma, acute trauma, And that mouth guard is going to help at night when all the healing takes place. So my take would be, yes, do it and follow their care. Uh, then Whitlock said, hello, dear Dr. Rita. Hi, back to you there in North Carolina. Please explain oxidative stress. Oxidative stress, usually you think of the term oxygen is needed to generate a campfire, or in your fireplace, you have to have the vent, the flute open so air will be drawn out of the room where the fireplace is and up the chimney, bringing and delivering oxygen into to help the burn of the coals or the wood. And then the soot and material will go and rise up with the heat. The thermal agitation will bring it up the chimney and out of the house. So then when you say the word oxidative stress, you're saying oxygen is involved. And we human beings, if you're a 150-pound, 180-pound woman, you're a 200-pound, 240-pound man, you are slowly cooking at your 150 and 200 pounds every day in an oxygen rich environment. You're slowly cooking or oxidizing or burning up, combining with oxygen. We are combining with oxygen biochemically for a controlled good value. That oxygen is working to forward the action of many biochemical phenomena throughout our human body. And then we have this wonderful God created waste removal. That's why you drink water. That's why you based yourself in drinking enough water every single day. That's the main reason why I drink water. And then that video, Dr. Pollack, Pollack, electrically structured water. Watch that YouTube video 2-3 times and learn about the magnificent creation of God of the water molecule and how it has many behaviors, personalities, you might say, so that the water that is right surrounding all the cell membranes is electrochemically more negative, and it is therefore creating a battery effect with the freed proton hydrogens, and that creates an energy potential for transmembrane potential for energy of the human body and life. And that includes all the membranes of the inside cell, intracellular material, and the mitochondrial membranes, and all the cristae, the invaginations of that membrane in the mitochondria. Water is very, very important, and it carries oxygen. So oxidative stress is when you have lost the God-designed management, cooling system, safe transfer of things. So you have to have an oven, and you put a pair of gloves on to take the roast out of the oven. So you need the food, and you put it on the table, and you have a happy husband and children, well fed. But you used an oxidative means to bring that meat to the table. You could have burnt your hands. You could have had a fire in the house. But when you have control mechanisms like the gloves, the lid to the oven, good insulation around your oven, then your house will not burn down. Healthcare is just learning to be a doctor who understands that you have to do safety things routinely to help you prevent burning up, injuring that cell membrane, burning your fingers on the hot pan that's hot and oxidized with oxygen and heat and fire cooking it up. So another way I talk about oxidative stress is I say the word inflammation. So you would say a fire in the fireplace or the oven is a inflamed place, a hot place. And that word inflammation would then mean injury to my finger if I touch the hot fired oxygen driven heat. It would burn my finger. The same is happening to a cell membrane. Remember how I always show you this picture of the cell membrane that's injured and the cell membrane that's healed at night. Every night you go to bed, you have to turn all your little injuries, because there is no cell that's 100% perfect in dealing with all the cooked roasts and all the cooked molecules that have to be done to repair and build our bodies. So there's a little bit of damage, and you have to fix it every night with a good night's sleep. So it's not right to stay up late. It's not right to have the light on. It's not right to be staying in bed late at night. It is good to exercise. So that injury, that inflammation is oxidative stress, which is combining with oxygen and burning up. I hope that helps you really understand it now. Jennifer, one for you. Dr. Rita, why did the pillow go to the doctor? He was feeling all stuffed up. Thank you for loving and helping us all. Well, that is cute. Why did the pillow go to the doctor? He was feeling all stuffed up. There you go. And that's me with all my allergies, that's for sure. Okay, let's get back to some of these others. Jennifer, thank you. Rah rah for the joy in life, the joy makers. All right, let's see. Next one. Nori says, if you grew up eating seed oils, you're hearing about all the seed oils finally. Cottonseed oil, safflower oil, corn oil, all these from vegetable seed oils. And how they have fatty acids in them that are damaging, and they become trans fatty acids very often, and they have amplified damage when they're heated up. So, and they go through a chemical process usually to make these seed oils that make them terrible for the body, and it gets into your membranes. So she goes on to say, how long will it take to get rid of in your body of all the accumulation of these seed oils and their harmful effects? Thanks. In general, the seed oils can get into your cell membranes. These, and they do, they do. So if you're going to eat a Dorita chip or a potato chip, or you're going to eat those oils that you dip tortilla chips in, you cheese dips, all this stuff is not normal, long shelf life, destroyed stuff called food that you've been tricked into eating. And they will flavor it with butter flavorings or salts or sweet, and you'll get addicted to it. And then you have to rebuild those membranes I showed you in the picture. The membranes are made of phospholipids and fat and protein and cholesterol. So if you take these and eat them, which we have been at an increasing rate, we're seeing cancers go up. And one of the things they don't want to tell you about these silly, evil research, hidden research. And again, remember, I've been preaching for decades how Marcia Engel, the chief editor of New England Journal of Medicine, 2006, when she was retiring, all these people come out with the truth when they're retiring. She said, it's sad to say as I leave, something paraphrased, I'm paraphrasing, really most of the research today in medicine is junk science bought by industry to create fake promotionals to support their products. And it's only worse even today since 2006. I've been saying this for decades. I even saw it back in the cholesterol story time when my father was in food research, pointed out the lies about cholesterol. And then we know that Nina Tekla wrote the book Fat on Fat. The word fat is in the title. Is it Fat Chance? Big Fat Lie. The Big Fat Lie. That's the name of her book. And she points out that the research done at the VA hospitals, where they gave the seed oils to these people and avoided all the saturated fats, it had a clear-cut clearly defined, even replicated over and over again since the 1990s, of increased cancer risk. So that's another contributor to all the increased cancers we're seeing now, more so in the younger, the more they're exposed, and mothers exposed to it, and then transferring that to a poorly developed child with poor cell membranes. So these seed oils, that data was hidden. That data was hidden. So read Nina Tekla's book, uh, Big Fat Lie. I mean, it's just horrible. I could go on with story after story of the lying people with titles, titles of nobility, titles of PhDs piled higher and deeper. I mean, I just told my patients this week, I think you should ask anyone who's going to work on your house, be your doctor, advise you in counsel, do anything that it has impact on how you manage your life or live where you live. You need to ask them what their worldview is. Where do they make their moral based decisions from? What theory? And hopefully they'll say it's from a God fearing theory, and that they do feel accountable to a higher superior being. Because most people today are not loving the Lord, and they're not feeling they're going to be held responsible or have to face accountability someday. They may get away with it, but I fear one thing in life, and that is my Lord in a healthy way. I fear offending him or hurting him or bringing shame to his name. So we live in a corrupt society, and so this thing about how long will it take for you to get your seed oils out? I'm going to say approximately 2 years, maybe 2 to 6 years. So there's your answer. Nobody wants to study chemistry and major in chemistry and biochemistry. Nobody wants to do the work. And therefore, you're always ignorant, and you're afraid to speak your peace of mind or your common sense as a clinician or a doctor with even just biology as a major. And you have fancy words. Some biochemist says, no, no, no. Well, you ask those people, what do you make your decisions on, and show me the paperwork, because they are going to come up with lack of confidence in how they make their decisions and in their ability to defend their scientific state. All right, that's on the oils. Next one says, hi, Dr. E. My mom is 74 and in good health. The only medicine she takes is levothyroxine. Her recent lab showed total cholesterol 315, triglycerides 73. Very good. Proud of her, because triglycerides are made from eating carbohydrates, starches, fruit sugars. Carbohydrates are turned into a simple fat when they are not burnt up from exercise. HDL, high density lipoprotein, is basically associated with exercise, and her level is 86. That's fabulous. So that her triglycerides are 76 and her HDL is higher from exercise at 86. Good for her. And her LDL is 218. Now, standard doctors would pee their pants because the cholesterol is 315 and the LDL is 218. And this has been debunked. This is clearly not where the problem is. The problem has always been the triglyceride level, sugar level, the HDL level. Her hemoglobin A1C is 5.4, very good. She's worried that her doctor will put her on statins, which she doesn't want to take. So unless he wrestles her down like a steer being roped by a cowboy, nobody's going to shove that down her throat unless she goes out and gets it and takes it herself. There's a wonderful video out there. High cholesterol is healthy. Watch that YouTube video. Let me know if she needs to change her diet. Well, I am not treating over the video. It's just been well established that saturated fats are not the cause of heart disease. And it's been well established that LDL of itself is not a concern for heart disease. And they've been suppressing the sugar data for decades and decades. And it's the sugar, high triglycerides. They would say it's still normal. They would say this, but it's not. That a triglyceride level of 150 is fine. Well, that's horrible. That's way out of control. So you need to get your triglycerides around 70 to 50 range and your HDL in the same range, 50 to 70. That's with exercise and a low carb diet, not eating late at night. So tell her to watch High Cholesterol is Healthy and bring up those 8 or 10 studies they refer there and bring it up to her doctor and ask, if I were to take cholesterol for the next 10, 15, 20 years, however long I live, how much life expectancy will it give me compared to if I didn't? And you want to know what the data suggests? It'll add to you maybe 3 to 7 days of extra life. But it's associated with mental, cognitive, joint pains, and muscle pains. My goodness. At least bring it up and have a discussion with your doctor. Tracy said, what is your opinion of parasite cleanses? I did that on the last YouTube. You can look back there. In general, it's a marketing thing. Everyone is going to put a little, they'll wave a wand over a product and say it has 5 milligrams of fenbendazole and 3 milligrams of ivermectin. Ooh, isn't this great? Get rid of parasites. Well, I'll tell you what, that's a subtherapeutic dose and you're being conned. I'm so sorry. Without God, we can't have a good world. Without him, we can't. And so you have to sell products that you yourself would say, God, I offered this in integrity and honor of my best ability to research the benefits. So most of this stuff is rubbish. Most of this fear mongering that everyone's got a parasite now is rubbish. Mary says, do you recommend the regimen of silver, zinc, vitamin C, and vitamin DK2 when sickness is going around? Yes, I do. Or you've been with sick folks or just starting with symptoms? Yes, the answer is yes. I take a lot of supplements already, so these are something I take daily. And she says she was at a birthday party and a couple of folks were really ill. Would you start the immune building vitamins? Well, I take zinc, C, vitamin D every day, silver. And that's because I guess I'm a doctor in my 70s working 5 days a week and I am exposed all the time, maybe to sick people or my grandchildren. And so, no, I think you should be on them all the time and just take more at any given moment for a week to make sure you don't get ill. I always fast when I think I'm getting ill, and I always drink more water. Then I'll do a high dose vitamin C drip. Let's see, do I have anything else? Yeah, let me get these last live ones here. Mano says, how do you remove dental amalgams made of mercury, tin, silver, etc. from the body? You have to go to a biological dentist who is familiar, where they put a dam in and they have a vacuum of the air because the gases and the high-speed drill will aerosolize the mercury and you'll breathe it in. So that's how you get rid of it, with a biological dentist. And a Siri Inception. Why are people getting lonely these days, doctor? I think they don't. I'm I'm always with God. God is always with me. I can always talk to Him. I honestly think we don't have a good grounding of the meaning of life and why we're here. And whether you are a wonderful man like my husband, who is a carpenter and doing helper jobs, and he cared for our children while I was at work in the ER, that's an honorable work. There was a song years ago called if I were a carpenter and you were a lady, would you marry me anyway? I always thought of that song, many years after I got married. And I was a doctor because I married him at 17. I never thought I was going to be a doctor. But what I had was God. And in that, I knew I was supposed to love him and keep my contract, my vow, my covenant, just like God is keeping his covenant with me. He knows that I make mistakes and I could never pay for them. And so my worldview is that Jesus Christ is the fulfillment of all the promises of the Old Testament prediction of Messiah, and that he has come and he's fulfilled it all. And then because I believe this, and I try and live my life to build his kingdom now and give him all the glory, that he will do what's right by me, and I'm at peace with the death issue. When I die, I'm not worried at all. So I don't have to worry about the future or trying to manipulate anyone. All I need to do is bring good news to people, not critical news, good news. I'm a little critical about the medical system, I admit. So that's what I would say about why are people getting lonely? Not enough people read their Bible. I read it 3, 4 chapters every day of my life. Year to year, I read it cover to cover. Debbie says, hi, Dr. Rita. I have grand kiddos ages 10 to 15 years old. So you have grandchildren. The family is limited on funds. So I'm wondering, what would be the 2 most important supplements to keep the kids' immune system up? Vitamin D, 5,000 each with K2, and I would put them on Juice Plus, hands down. And with that, I'm 5 minutes over. I've gone over, and so I'll get to the rest of these questions next week. May the Lord bless and keep us all. Pray for us here that we do the right thing. All us doctors are here for the right reason and not for money alone. And pray for our country, for the peace of the world, and that we just recognize how precious life is. And thank you so much for your prayers. God bless. Thank you. And like and subscribe. Bye-bye.